Hi, Mrs. Feeks.
Hi.
What is OCD?
OCD is a mental health condition that's characterized by distressing, intrusive, usually obsessive thoughts that can be repetitive and compulsive in nature. It's considered a disorder in the Diagnostical and Statistical Manual of Disorders. And it's called obsessive compulsive disorder.
Okay. So, what are common causes of OCD?
There could be a couple of causes. There's actually no known cause specifically. There have been studies that it can be hereditary. I know that was actually one of your questions. It can be hereditary, but they've also found that neurologically, they found that there's an imbalance of serotonin, the chemical serotonin in the brain, which also could be hereditary, although they found that even individuals where OCD is not in the family, there's an imbalance in serotonin, which I said is a brain chemical, it's neurological, and it interferes with the synapses, the connection between neurons in the brain. There could be other causes that are more rare. They talk about an autoimmune cause, which actually has to do with like people getting strep. The bacteria from strep can lead to OCD in certain patients. Also, they mentioned Lyme. I mean, this is more current research. People who have been affected with Lyme's disease later in life may develop OCD tendencies. Behavioral causes, there's also that type where things in the environment, certain people will develop OCD later in life basically because of fear. Fear from objects, fear from things that may happen if they don't do something a certain number of times.
Right.
Okay?
Okay, so what gender is most commonly affected by OCD?
Well, most OCD usually develops later in life, not so much later as in old age, but between the ages of 19 and about 36. And among adults, OCD is equal in gender.
Oh.
It's male and female. There's no dominant side. But for childhood OCD, the onset is usually around 9 years old, and that's predominantly males.
So, are there several types of OCD, or is OCD just one thing?
There's the types of OCDs kind of like, there's not so many types of it. It's either considered obsession or compulsion, okay, or both. An obsession is more characterized by the thoughts. People who will dwell on certain ideas. Certain things, if, let's say, as an example, if you were going to go, let's say on a school trip,
Right.
okay, and you knew you had to plan ahead for the school trip. You had to bring a bag lunch, you had to have the right shoes. A person with OCD may dwell on that thought and that planning process an extreme amount of hours compared to the regular person. So that's talking about the thought process, the obsessive thinking. The compulsion side of it is I can characterize as the doing part. Mm-hmm. The compulsion is where someone could do something repetitively, whether it be hand washing, feeling that their hands are not clean enough, having an obsession with germs, contamination. Another compulsion is locking doors, locking and unlocking, making sure they're doing it a certain number of times. The number can come from a situation, a fear of a situation, where they fear if they don't do it that certain number of times, maybe something bad may happen. So those are the two types. Most people, like I said, it's usually if you may have the obsessive side, the compulsive side, or both. So you can either have 1, 2, or 3, or all both. That's what I mean, one or both.
So, if a person has OCD, can they do certain types of therapy to help them out with it?
There is treatment for OCD, but it's not something that would go away. That's for sure. The different therapies that they have, first there's medication. Because they found that there's an imbalance of serotonin in the brain, there's medications. They're called SSRIs. It's basically a serotonin. Actually, it's a selectively inhibiting the blocking of serotonin reuptake in the brain. SSRIs, what they use, the medication that they use, certain ones are Prozac, Paxil, Lexapro, Lorax, Zoloft. These medications are actually used to treat depression. They're antidepressants. For OCD, what a doctor will usually prescribe is almost like a double dose. It's usually a much higher dosage to treat the OCD than the depression. If that doesn't seem to work, doctors will also prescribe antipsychotic medications, Risperdal, Zyprexa, Abilify, and those would be added on, not separately, but added on to it. Another treatment is cognitive behavioral therapy. That's basically a treatment where mostly the patient will sit with a psychiatrist, and it's a therapy where it's a psychotherapy where we will desensitize the fear, the person. We will go through different techniques, thought restructuring, where we can make the obsessive thought decrease the fear to the point where you're introducing that fear to the person, finding out what that fear is, and slowly flooding that person. I don't want to say exactly flooding, but the point is, it's like if you had a fear of snakes, okay, and you couldn't go to a zoo.
Right.
All right. Step by step, we would approach that fear. You would get closer to it. That way, you would not be as sensitive as you were to it before. So, restructuring your thinking through psychotherapy and introducing that fear and slowly working towards eliminating that fear and that compulsion that goes along with it.
Okay, so here's my last question.
Mm-hmm.
Can OCD affect an individual in a positive way as well as a negative way?
Well, let's go the positive way first. I mean, there's not that many positives because with OCD, usually the obsessions and the compulsions end up really interfering with a person's lifestyle. Like I mentioned, use the example of you possibly going on a class trip, right? When the OCD is very severe, that person may not even leave the house to get to the trip. Meaning that there is so much preparation in order to get there that they miss the trip or they're late for it. It will consume a person's thinking, it will consume their life.
Right.
It causes a lot of anxiety, and I mean, this could be almost going towards the negative side where most people with OCD will also have other disorders. They call it comorbidity. Comorbid disorders that go along with OCD is usually anxiety, can be depression. Okay, so those are big ones because they cannot function. They have this need, they need to do it, but at the same time they're missing out on life because their life is so consumed of the disorder of the OCD. The small positives that come along with OCD is because they are usually very rigid.
Right.
They have good memory skills. They have good planning skills. But really when it comes to that, that's about it. OCD is still a disorder. It can be debilitating to a person's life. And really, if it's left untreated without psychotherapy or without medication, it can worsen to the point where some people have been known to take their own life.
Oh my goodness.
There's a study about, in North America alone, there's about 1% of people who are OCD and who have taken their own life because of it.
Wow. Okay, well, thank you for your time, Mrs. Feeks.
You're very, very welcome, Angelina. I hope you do well.